This year's Payer Award goes to a managed care organization that developed what they called the authorization workflow of the future in their proposal to us. Reminiscent of something towards the end of the spectrum of Dr. Tord's talk yesterday. And this automated portal that was between them and providers and using MCG technology and tools allowed them to decrease a number of things in workload. First of all, 20 to 30% of authorizations were automatic. There was no further intervention. And for the rest, when there was needed intervention, they saw an 11 to 14 minute decrease per case in any medical necessity review time. They did not get rid of the immortal fax machine. It's still around. But some providers reported up to a 60% decrease in fax volume, and they saw about a 20-hour per week decrease in utilization management team work. So with that, I am very pleased to present the Payer Award to CareSource, being received by Dr. Giselle Goff and her team.
Pull this down, I'm a little vertically challenged. I'll just start out by saying thank you, MCG, for giving us this award. Really, we've worked hard to do a lot of the work. I won't spend a lot of time on kind of the why. He's giving you a lot of the KPIs already as to what we do and why we do it. And really shameless plug, some of our leaders will be talking about and sharing our best practices later on. So make sure that you attend that session if you're curious about what we're doing at CareSource. I'll spend this opportunity, though, really talking about our why. Reflect back at the start of the Medicare, Medicaid, implementation. I have a quote from Lyndon B. Johnson. It says, "Medical care will free millions from their misery. It will signal a deep and lasting change in the American way of life. It will take its place beside Social Security, and together they will form the twin pillars of protection upon which all of our people can safely build their lives and their hopes." 20 years later or so, CareSource was founded. It was founded by a social worker who dreamed differently about healthcare. She had the vision to put the member at the center of what we do. Today, we recognize it as patient-centered care. A lot of the tools she put in place, we have a fancy term called social determinants of health. Imagine in the 80s, we had gone through the AIDS epidemic and drug infestation in urban as well as our rural communities. Today, we continue to use that patient-centered model to make a change and to partner with and collaborate with our innovative partners like MCG to help reduce the physician abrasion, to give best outcomes to our members, to have member satisfaction, and introduce health equity. We're delighted and certainly proud of all the hard work we've done. This leadership team shows up each and every day, coming to the table, thinking about innovative ways to make a change in the people that we serve. Currently, we started in one state. We currently are in 8 states. Over the 35 years, we've built something that we can be very proud of. And it is with the tenacity and the innovation that we partner with great vendors like MCG to make our move forward. We represent our 2+ million members because they are the heartbeat of what we do. They are our reason why. And today, on behalf of our President and CEO, Erhard Preytower, our CMO, Dr. David Williams in his absence, and all of those 2+ million members, we thank you for this honor.